In the last lesson, we discussed why dementia is not an inevitable part of getting older. I described the differences between healthy aging, mild cognitive impairment, and dementia. In this lesson, I want to help you to identify the early warning signs of dementia and ensure you obtain a correct diagnosis for the symptoms that you or the person you are caring for are experiencing. This is really important because many dementia-like symptoms can be easily confused with other treatable conditions. It's also really important to say that if you're worried that you or someone else are showing the signs or symptoms of dementia, you should speak to your GP or physician to get professional medical advice. The content in this course should not be used to replace professional medical help. The early signs of dementia are very subtle and vague and may not be immediately obvious. So early symptoms also vary a great deal. Usually though, people first seem to notice that there's a problem with memory, particularly in remembering recent events. So other common symptoms include confusion, personality change, apathy and withdrawal, loss of ability to do everyday tasks, and sometimes people fail to recognise these symptoms indicate that something is actually wrong. They may mistakenly assume that such a behaviour is a normal part of the ageing process, or symptoms may develop gradually and go unnoticed for a long time. And sometimes people may refuse to act even when they know something is wrong. So here are the 10 warning signs to look out for. This is a checklist of common symptoms of dementia. Go through the list of the symptoms. If there are several that you say yes to, you should consult a doctor for a complete examination of the person with the symptoms. So first is recent memory loss that affects the skills to perform a job. It's normal to forget meetings, colleagues' names or a business associate's telephone number occasionally, but then remember them later. A person with dementia may forget things more often and not remember them later. Second is difficulty performing familiar tasks. Busy people can be so distracted from time to time that they may leave the carrots on the stove and only remember to serve them when the meal is finished. But a person with dementia might prepare a meal and not only forget to serve it, but also forget they made it. Third is problems with language. Everyone has trouble finding the right words sometimes, and a person with dementia may forget simple words or substitute inappropriate words. Fourth is disorientation of time and place. It's normal to forget the day of the week of your destination for a moment, but people with dementia can become lost on their own street, not know where they are, how they got there, or how to get back home. Fifth is poor or decreased judgment. Dementia affects a person's memory and concentration, and this in turn affects their judgment. So many activities such as driving require good judgment, and when this ability is affected, the person will be a risk, not only to themselves, but to others on the road as well. Sixth is problems with abstract thinking. Managing finances can be difficult for anyone, but a person with dementia may have trouble knowing what the numbers mean or what to do with them. Seventh is misplacing things. Anyone can temporarily misplace a wallet or keys, but a person with dementia may repeatedly put things in inappropriate places. Let's look at Sarah, who keeps misplacing things to see if she has the signs of dementia. So Sarah couldn't find her car keys. She looked on the hook just inside the front door. They weren't there. She searched in her purse, no luck. Finally, she found them on her desk. Yesterday, she forgot her neighbour's name. Her memory was playing tricks on her. She was really starting to worry about it. So she decided to see her doctor. After a complete checkup, her doctor said that Sarah was fine. Her forgetfulness was just a normal part of getting older. And the doctor suggested that Sarah take an exercise class, play cards with friends, or take on a new role like helping out at the local school to help her memory. Eighth is obvious changes in mood or behaviour. Everyone becomes sad or moody from time to time, but someone with dementia can have rapid mood swings from calm to tears to anger for no apparent reason. So let's look at Hayley's story, who had noticed changes to her mood to see if she had the early signs of dementia. Hayley was feeling sad all the time. She just wanted to sleep all day and night. She was becoming really forgetful too. And Hayley's nephew Peter was afraid something was really wrong. He took her to see a doctor. The doctor diagnosed her with depression, prescribed antidepressant medication, and referred her for talking therapy. After 3 months, Peter could see the change in his aunt. She was eating and sleeping. Hayley was spending more time with friends and doing volunteer work. Ninth is changes to personality. People's personalities can change a little with age, but a person with dementia can become suspicious or fearful or just apathetic and uncommunicative. They may also become disinhibited, that's saying and doing inappropriate things, or become overfamiliar or more outgoing than previously. 10th is loss of initiative. It's normal to tire of housework, business activities or social obligations, but a person with dementia may become very passive and require cues and prompting them to become involved in activities. So these are the 10 warning signs of dementia, but don't start from the position of assuming it's dementia. Many conditions have symptoms that are really similar to dementia, so it's really important not to assume that someone has dementia just because some of the symptoms are present. So there are more than 40 medical conditions that can actually mimic the symptoms of dementia, misleading people into believing they are demented. So for example, certain medical conditions can cause serious memory problems. And these problems should go away once a person gets treatment. Medical conditions that may cause memory problems include things like tumours, blood clots or infections in the brain, some thyroid, kidney or liver disorders, drinking too much alcohol, head injury such as a concussion from a fall or accident, medication side effects, not eating enough healthy foods, or too few vitamins and minerals in a person's body like vitamin B12. And many of these conditions can be treated, and a doctor should treat serious medical conditions like these as soon as possible. Emotional problems such as stress, anxiety or depression can make a person more forgetful and can be mistaken for dementia as well. So for instance, someone who has recently retired or is coping with the death of a spouse, relative or friend may feel sad, lonely, worried or even bored. And trying to deal with these life-changing events leaves some people feeling confused or forgetful. And the confusion and forgetfulness caused by emotional problems usually are temporary and go away when the feelings fade. And emotional problems can be eased by supportive friends and family, but if these feelings persist and last for more than a few weeks, it's important to get help from a doctor or therapist. Treatment may include talking therapy, medication, or both. And being active and learning new skills can also help a person feel better and improve his or her memory. So it's critical to obtain a correct diagnosis, and consulting a doctor to obtain a diagnosis is critical at an early stage. A complete medical and psychological assessment may identify a treatable condition and ensure that it's treated correctly, or confirm the presence of dementia and then ensure assistance is provided. So such an assessment might include the following. So a detailed medical history provided if possible by the person with the symptoms and a close relative or friend. This helps to establish whether there is a slow or sudden onset of symptoms and their progression. A thorough physical and neurological examination, including tests of the senses and movements to rule out other causes of dementia and to identify medical illnesses which may worsen the confusion associated with dementia. So laboratory tests including a variety of blood and urine tests called a dementia screen to test for a variety of possible illnesses which could be responsible for the symptoms. The dementia screen is available through a doctor. Neuropsychological testing to identify retained abilities and specific problem areas such as comprehension, insight and judgment. And other specialised tests would include a chest x-ray, ECG, CT or MRI scan. A mental status test to check the range of cognitive functions affected by the dementia, such as memory, the ability to read, write and calculate. A psychiatric assessment to identify treatable disorders which can mimic dementia, such as depression, and also to manage psychiatric symptoms such as anxiety or delusions, which can occur alongside a neurological disorder. So where do you begin with exploring a diagnosis? Well, the best place to start the diagnostic process is with your local GP or physician, who, after considering the symptoms and ordering screening tests, may offer a preliminary diagnosis or refer the person to a neurologist or psychiatrist. Some people may be resistant to the idea of visiting a doctor. And in some cases, people don't realise or else deny there is actually anything wrong with them. And this can be due to the brain changes of dementia itself that interfere with the ability to recognise or appreciate one's own memory problems. Others with retained insight may be afraid of having their fears confirmed. So one of the most effective ways to overcome this problem is to find a physical reason for a visit to the doctor, preferably a checkup for a symptom that the person is willing to acknowledge, such as headaches or failing eyesight, for example. So perhaps suggest an examination of the heart, a test for blood pressure or diabetes, or a review of long-term medication. Another way is to suggest that it's time for you both to have a physical checkup. Any expressed anxiety by the person is an excellent opportunity to suggest a visit to the doctor. So be sure to provide a lot of reassurance. Calm, caring attitude at this time can really help overcome the person's very real worries and fears. So if you need additional support in the UK, you can contact the Alzheimer's Society National Dementia Support Helpline on 0333 150 3456 or contact the Alzheimer's Association in your country, details of which can be found in the resources pages for this lesson. So what are the key messages to take away from this lesson? There are a number of early warning signs of dementia to look out for that will help you obtain a correct diagnosis for the symptoms that you or the person you are caring for are experiencing. Many other treatable conditions can cause memory and emotional problems that can be easily confused with dementia. So it's critical to start the process of diagnosing the symptoms by consulting your GP or physician. So I hope this lesson has helped to identify some of the early warning signs of dementia and given you the tools to ensure you obtain a correct diagnosis for the symptoms that you or the person you are caring for are experiencing. In the next lesson, we're going to look more closely at the different types of dementia and their signs and symptoms. There are actually more than 200 subtypes of dementia, but we'll only consider the 5 most common types. So I will look forward to seeing you there.